So, good morning all. Can you hear me all?
Good morning,
So
sir.
today's topic is tetanus.
Good morning, sir. Good morning.
Good morning, good morning. Good morning. Today's topic is tetanus. It's very common disorders. Everybody knows. I think a non-medical person also knows about this tetanus and how this tetanus is happening and what is this disease. What is the pathophysiology of it, and what are the clinical diagnosis, and how we can give a treatment. What is the treatment or management process that we will discuss. That would be our topics today. So tetanus, we know the causative organism of it. It's a bacteria which is known as Clostridium tetani, which is an anaerobic spore bearing bacteria. That spore is looking like a dumbbell shaped, looking like it bears spore, and that spore is going to be germinated under anaerobic condition only, and it can be propagated during this anaerobic conditions. So whenever any prick or any injury which happens, and through that injured area it is entering into the body. So tetanus is a gram-negative bacteria and anaerobic bacteria. That means it's a spore-bearing bacteria. For the propagation of this bacteria and germination would be possible when there is in anaerobic conditions develops. So generally it is found on soil and especially the animal's gut. It is not creating any pathogenesis when it is living inside the animal guts. So when generally other animal stool is mixed with the soil, and this is going to be contaminated with Clostridium spore, Clostridium tetani spores. And when there is any injury or pricking injury or any injury which is going to be contaminated with that soil, which is having some causative organisms, then it is entering into the body through the blood, and actually it is a neurotoxic exotoxin which is produced by tetanospasmin. Tetanospasmin, it's a neurotoxic materials, and this neurotoxic materials, how it works, it is entering through the injured skin and through the lymphatics and blood. It is sprayed. It is going towards to the axons, to the nerves, and these axons, especially it enters into the central nervous system. Through central nervous system, it is going to neuromuscular junction, and particularly in a neuromuscular junction where it works on the neurotransmitter. It works on the synapses. And what is there on synapses, the synaptic, there this motor neurons, particularly motor neurons is going to be affected, and motor synapses, neuromuscular junction, and there this presynaptic membrane, it is going to be attached. And when it is going to be attached, that from the presynaptic membrane, this synaptic transmitters which is going to happen there, and also some inhibitory effects that GABA is produced, which is coming from that releasing from this presynaptic membrane. It is going to inhibit the action of GABA or glycine. This is in the neurotransmitters, this which is neuroinhibitors. And what happens when neuroinhibitors, it is inhibiting this neuroinhibitors is not there, absence of inhibitors. What is happening? Whatever the stimulation is getting, this motor nerve is giving response, or all the responses which is received by the sensory nerves. So when it is giving responses, so this is also another effect, is that neurotransmitter, this muscles contraction is doing, but relaxant factors is going to be stopped. So this relaxant are not released, relaxant action is going to be stabilized, and that is how in a continuous contraction phase you will get muscles contraction phase. And sometimes what happens, this muscle contraction is that much vigorous that it can cause a muscle tear, or sometimes broken, this is a fracture of bones is happening. Generally this disease also known as this lockjaw. It starts from the nearest to the brain, and after that it is going downward. So generally the first symptoms is happening, the jaw muscles involvement of the jaw muscles. Then this jaw muscles involvement is known as locked jaw. It is producing and is causing the trismus. This condition is known as the trismus conditions. And after that, facial muscle sometimes going to be involved and producing a typical facies of tetanus is known as risa sardonicus. Now what is there? The indrawing of the angle of the mouth outward, indrawing of the eyes like this way when the masseter's muscles are doing a spasm, that is happening. Then after that it is going to the muscles of the pharynx, larynx, and then respiratory problems will come up. Muscles of the thorax, muscles of the abdomen, muscles of the back is happening. When back is going to be contracted vigorously, then tetanus is coming up. So slowly we will discuss of this disease, and it develops like this way. So what happens when anaerobic bacteria enters? It needs anaerobic conditions of the injured place. So there what happens? It is always along with aerobic bacteria is also going to be infected, and that aerobic bacteria, when it is going to develop, when it is going to infect that area of the infection, they used to utilize all the oxygens there. Then this condition is making favorable for the germination of anaerobic bacteria. So all the oxygen is utilized by the aerobic bacteria, which are commonly going to infect at the place of injury, and which through this anaerobic bacteria Clostridium tetani is going to be germinated. So that is how it is spreaded, and it is when the spores are germinated and producing exotoxins. They are going to travel through the blood and lymphatics, through the motor axons, and reaching to the neuromuscular junction where synapses there and presynaptic membrane they are going to attach, and inhibiting the release of GABA, which is an neuroinhibitor. So when it is neuroinhibitor not acting properly, then chances of propagation of the impulses from the nerve ending to the effector muscles, and effector muscles continuously in a spasm stage. Not only that, it is also the relaxing factors are also not working well due to these exotoxins. So it's a Greek word. Tetanus means it's a Greek word. It's a Greek word. Two stage. It was first described. It was first diagnosed during time of Hippocrates and Sushruta. That is up 4th-5th century before Christ. A neurological disease characterized by increased muscle stones and spasm. It is increasing muscle stone, and I told you this is in contractile stage. Muscles are found in a contractile stage, and causative organism is a Clostridium tetani, an anaerobic motile, a gram-positive rod, and forms oval, colorless, terminal spores are there. It's like a tennis racket or drumstick shape that you have already read in pathology, and bacteriology you have already studied. It is found in a soil, and that I told you in inanimate environment, animal feces, and that is a very common place of of residents commonly found in animal gut, and through the feces is coming out. It looks like this. You can see the slide here. The bacteria's appearance is like this. This is a racket of badmintons. Can you see? This is the handle. This is the spore, a rod shape, and at the top of the rod you will get a spore. It occurs sporadically, and it affects immunized, partially immunized and fully immunized who fail to maintain adequate immunity with the booster dose of vaccines. Generally, this is those who are a lot of persons are already immunized, but still they can develop. Chances of development is less, but still it is found. Even immunized persons are developing this disease. Entirely it is a preventable disease by immunization, and worldwide burden it is you will get all over world people are going to be affected by this disease. Particularly this WHO also considers reported cases to be underestimated and takes case death estimates to assess the burden of the disease. In 2002, the estimated death in all age group about 2,13,000, and of which 1,80,000 were attributed by neonatal tetanus. So tetanus, different type of tetanus are there: a cephalic tetanus, a neonatal tetanus, a local tetanus, generalized tetanus. Lot of varieties are there that will come later on. More common in areas where soil is cultivated, and rural areas, warm climates it is happening. The pathophysiology of it that we have already I told you. Contamination of wounds with the spores of Clostridium tetani, and germinates and toxin productions are there in the wounds, where low oxidations are there, reduction potential is very less, especially the devitalized tissues. When the tissues are going to die, and on devitalized tissue it is found, it's a neurotoxin, tetanospasmin is going to be produced. One is tetanolysin, symolysins, one another toxins which is produced. Tetanospasmin produced locally, and generally it released into the bloodstream, and peripheral motor neuron terminals and nerve cells of anterior horn of the spinal cord. Through that it is going to be transmitted to the synapses of motor nerves. And the toxins after entering axons transport to nerve cell body and body in the brain stem and spinal cord. The retrograde intraneural transport is known as interneural retrograde transport is known as. Toxins generally migrate across synapses on the presynaptic terminals. It blocks and release of glycine and GABA. That I told you that glycine and GABA, these are neurotransmitters, the inhibitors, but impulses all our sensory systems is receiving. Not all should be propagated to the motor nerves, to the target organs. Here, when GABA deficiency is there, not working GABA is there, but it is not due to this toxins. It is not working properly, cannot work properly. So blocking of neurotransmitter released by tetanospasmin involves cleavage of synaptobrevin. This cleavage of synaptobrevin, this is synaptobrevin, it is an enzyme which is helping in releasing of GABA from the presynaptic vesicles. So what happened is the synaptobrevin is it is inhibiting, this effect is restricted by these toxins. With diminished inhibition, resting freezes and rigidity of alpha motor neurons increases. So these are the conditions. This is a injury happens generally which contacts with the surface of the soil, and it is passing through the lymphatics as well as bloodstream and entering into through the axons. It is entering into the motor root. It is going to the dorsal. This is your ventral root, and through the motor nerve it is going to the neuromuscular junction where it is working. And these conditions, this is a trismus, the spasm is happening, and also rhesus salonica stage. This is not only spasm, it develops as rhesus salonica stage. You can see the angle of the mouth, it is outwardly outdrawn of this angle of the mouth, and eyes, this angle of eyes also, and you can see the neck rigidity of the neck muscle. This is happening of the neck muscle spasm, and the back muscle spasm. This condition is known as opisthottonus. Opisthottonus. So loss of inhibitions of preganglionic synaptic neurons, that's sympathetic hyperactivity is happening, and mode of transmission may occur by contamination of the wounds, so that in the spores, and generally this other than that some trivial pin prick. Sometimes what happens, the patient is getting a prick injury, pin prick injury, but he is to forget what happened. But suddenly few months after, he developed that tetanus, and that incubation period it depends on few days to few weeks to few months even. Generally it is happening 3 days to 21 days. It is written everywhere in the book. But it is found even after 3 months also it can develop. So virulency of this bacteria or virulency of these symptoms, severity of the symptoms depends on how much close to the central nervous system this injury is happening. Where the entry of bacteria, how much, in which distance it is entering into from which distance it is entering, it is how far from the central nervous system. It is very important. The trivial pinprick to skin abrasions, puncture wounds, burns, human bites, even it is also found in saliva. Animal saliva also it is found, and that is how the human bites also can cause tetanus. Intrauterine devices, bowel surgery, dental extraction, injections, unsterile divisions, umbilical cord compound fracture, otitis media, chronic skin ulcer, eye infection, gangrene. These are the causes. These are the injuries where it happens. This transmission is happening. It is not transmitted from person to person. Traumatic types, peripheral type, autogenic type, idiopathic type, tetanus neonatorum. These are different variety. Generalized, neonatal, local. What is general and local? Sometimes what happens, if virulence is very low, where it is going to be infected at this nerve end, directly it is involving the peripheral nerve endings, motor nerve endings, and causing local spasm of the muscle. Local spasm of the muscles, that is called local. Neonatal means, the neonates, who is very frequently going to be affected from the mothers when during time of delivery, they are going to be affected, and especially on separation of umbilical cord. If it is not maintaining a sterilized way, it is not doing in a sterilized way, then it is happening. Especially in case of home delivery, it is very, very common in the rural area where this proper sterilization technique is not maintained, not adopted during separation of cord separations, and also mother is not immunized in antenatal care period. Antenatal care period, that is how the schedule is given. To mother should be immunized with tetanus, TEDVAC, tetanus toxoid to be given, and even on that cases when the mother is not properly immunized during antenatal period, at that time then mother can develop the puerperial tetanus. Maximum will get a traumatic, autogenic. Some will get infant or in any age when the person is suffering from chronic suppurative otitis media. From that the tetanus can be spread. That is autogenic. Some idiopathic, I told you sometimes what happens, small pin prick, where person is to forget what is happening when pin prick was there, or any nail pricking, small nail pricking is there and it is contaminated, and after that virulence is low, so an incubation period even 1 month, 2 months after also can develop. So that is idiopathic cases you will get, and some iatrogenic also sometimes during operation, surgical operation, if the instrument or OT is not properly sterilized and sterilization technique is not adopted, on that cases if a patient may develop tetanus. So clinical features, the main symptoms, main presenting features that I told you, that is a muscle spasm, and that muscle spasm above downwards direction is going from upper part to lower part of the body. So generally it is shorter the incubation period, more severe the attack and worse the prognosis. That I told you. Generalized tetanus is very common. Most common variety is generalized tetanus, increased muscle tone and generalized spasm is happening. So increased muscle tone, generalized spasm is happening. Median time of onset after getting injury of up to 7 days. And patient first notice the lockjaw. That is how this disease is also known. Another name of the disease is lockjaw disease or trismus. Increased tone in the masseter muscles, and after that slowly going down. That is how it is going to affect the muscles of pharynx and dysphagia happening. Stiffness of the neck, pain in the neck, shoulders, back muscles appear also, and concurrently and soon after there. So this rigid abdomen and stiff proximal limbs muscles, hands, feet spreaded. So that is how it is a trismus condition. You see, this is the lockjaw conditions, a trismus conditions. The involvement of the masseter muscle. This is sardonicus, a spasm of the facial muscles, a frontalis, an angle of mouth muscles affecting and producing grinning faces. Tetanus, that I told you about, that when back muscles are going to be contracted and spasm is there, it is causing painful spasm of the neck, trunk, extremity and bowing or arching back. And some patients develop paroxysmal violent painful generalized muscle spasm. It's not a continuous, it's a paroxysmal appearance is there and very painful, and sometimes this spasm I told you that much severe that cyanosis also develop. And spasm occurs repeatedly and may be spontaneous, provoked by slightest stimulations. Then it's a reflex action working. Polysynaptic reflexes is working. That is how external stimulus you have to take care of. That patient should be isolated in a calm, cool, quiet space where there should not be any external stimulation. Constant spread during general spasm is reduced. Ventilations, apnea, laryngospasms, patient should be kept in ventilations. This is sardonicus. Typical features, you will get spasm of the limbs also in this baby. This is a neck spasm as well as back muscles is going to be involved. This is office tetanus patient is going to develop, and severe office tetanus stage is like this. Sometimes it is so vigorous that no gap in between, you are getting no relief of the patients from the spasm. We will get a continuous spasm happening, and patient's appearance will be like that. It's like a bow. So mild cases will get muscles rigidity and very few spasms, sometimes no spasm will get. Some moderate cases, the strabismus and dysphagia, rigidity and spasm, the paroxysm only coming off. Severe explosive paroxysms comes up. A frequent explosive paroxysm. No gap is very small period is coming up. This is called severe conditions. Autonomic dysfunctions also complicates that I told you about. This function, when it is going to affect this motor synapses, at the same time it is having a autonomic nervous dysfunction. That is how we will get level type of hypertension, hyperpyrexia, profuse sweating, peripheral vasoconstriction, raised temperature, raised catecholamine secretions. That is how it is happening.